and welcome to Diversity of Science. Do you know what is that thing that everyone wants to achieve nowadays? Guess what? Having a flawless, spotless, clear skin. Yes, you guessed it right. Everyone wants to have a skin which is free of acne. But do you know why is acne caused? What might be the reasons behind it? And how could they be treated? So let's start with what is acne. Acne is a skin condition in which the spots and bumps appear on skin, which is formed by the dead skin cells, dead bacteria, excess oil production, and dust. The most common regions where acne appear is face, chest, and upper back. And why is that so? This is because there are more sebaceous or oil glands present in this region. Like I told you, there are different regions where acne appears, and this is because there are certain causes and reasons behind that. For instance, if your acne appears on nose, this could be because of presence of your oily skin, you have some digestion issues or high blood pressure. If your acne appears on jawline and chin region, then they might be hormonal changes or you have a starchy diet. If your acne appears on forehead, then this might be because of certain hair products that you are using, dandruff, stress, might be having some liver issues, or it is because of lack of sleep. If it is present on cheeks, then the reason could be because of rubbing or friction against cell phones or pillowcases. There might be some respiratory issues or smoking. Now, based on the different regions and different causes, there are different types of acne that a person might have. They might be blackheads, they might be whiteheads, they might be cysts, they might be papules, they might be pustules and nodules. Okay, so blackheads are formed when dead skin cells and excess oil collect in the follicle or the pores opening. Whiteheads are formed when the pores are clogged because of excess oil, whereas papules are formed when you have excess oil on your skin or the dead bacteria or hormones or because of some medications. While pustules are formed due to the allergic reaction to some kind of food or some environmental problems, or you might be having some poisonous insect's bite. Then there comes the most common and the most dangerous form of acne, which is the cystic acne. This is because of the presence of bacteria, some dead skin cells and oil trapped beneath the skin surface, which might lead to an infection. Then the last form is the nodules, which forms when the pores become blocked by the dead skin cells, hair or some excess oil. But that's not just the end of story. There might be other causes to the acne as well. And there also might be certain foods that you're having in your daily life which might lead to your acne problems. Like I told you that there are other causes of acne as well. So these include certain infections, UV impact, stress, hormonal disorders, premenstrual acne, diseases of some internal organs, if you're using some expired cosmetic products, or you can pop your pimple or certain medications. Now the foods that can cause acne includes dairy products, sugary foods including chocolates, some processed foods, junk food, and also the excess use of caffeine. Since there are so many causes and reasons for acne, let's just discuss the treatment for acne. Now there are two lines of treatment. Number one, that you can apply on your skin and get rid of acne, and number two, that you ingest orally and take some medication and get rid of acne. Starting off from the most common medication given to treat acne is retinoids, which are also known as vitamin A derivatives. The examples of this class include tretinoin, adapalene, and tazarotene. How to apply this? Basically, you start by applying it at night, starting off from the lowest percentage with 3 times a week, then you can use it on daily basis. But be careful, do not apply tretinoin with benzoyl peroxide. The side effect of tretinoin is it increases sun sensitivity, causes dry skin, redness, especially in people with brown skin. Now there are certain antibiotics used in the topical preparation to get rid of acne. These include clindamycin and erythromycin. They help control the acne by removing the surface bacteria of the skin. They are more effective when combined with benzoyl peroxide. Examples of this class include clindamycin with benzoyl peroxide. The example of the brand is benzaclane. Another most common and effective treatment of controlling acne nowadays is using azelaic acid. Azelaic acid is produced by yeast. It kills microorganisms on the skin and reduces swelling. A 20% azelaic acid cream or gel seems to be effective when used twice a day. Examples include Skinnerin, which is an option during pregnancy or breastfeeding days, also used for discoloration that occurs with some types of acne. The side effects of this include redness and minor skin irritation. Another topical acid used commonly for the treatment of acne is salicylic acid. Salicylic acid is used for acne in cleansers, ointment, or lotion formulations. It helps remove the top layer of the damaged skin. Salicylic acid dissolves the dead skin cells to prevent your hair follicles from clogging. I told you there are two lines of treatment, one that you can apply on skin to get rid of acne and the one that you can take orally as medication. So the oral medications include antibiotics, which includes tetracycline, doxycycline, which is best for moderate to severe acne. The other one is isotretinoin. It shrinks the slices of oil glands that forms acne. There are also contraceptives used for clearing acne. These are approved by FDA. Some brands include Estrosip, and yes, they contain a combination of estrogen and progesterones, which are a natural form of steroid that helps regulate menstruation cycles. The other form of oral treatment given to clear your acne is hormone therapy, which is used for some people with acne flare-ups during irregular periods caused by excess androgen, which is also a hormone. It consists of a low dose of birth control pills that blocks the effect of certain hormones at the level of hair follicles and oil glands. This was all from my side for today. Hope you liked today's video and this video might be very beneficial for you for future. Thank you and have a good day.